today I'm going to talk about thyroid medicine in pregnancy. What are the various thyroid medicines? So thyroid medicines are given basically for treating hypothyroidism and hyperthyroidism. So hypothyroidism is treated using a medicine called thyroid hormone. It goes with various popular brand names like Thyronorm or Eltroxin, Thyrox, like that. These are the various brand names. So if you are a woman who's taking these medication and you have hypothyroidism, what you should do is you should never stop these medication when you are pregnant, number one. Number two is that you should contact an endocrinologist and make sure that you take a adequate increase in medication. So for example, if you are taking 75 micrograms of thyroid hormone before you get pregnant and you now conceive, then you should increase the dose of thyroid hormone by 25%. So instead of 75, you should now take 100 microgram or thereabouts. And this quantum of increase should be ideally be decided by a good endocrinologist who's near you. Are these tablets harmful? These tablets are not at all harmful. They are in fact essential for you and for your baby if you are having hypothyroidism. Hypothyroidism is a condition in most of the cases, in 95% of the cases, the disease is due to autoimmune disease. It's a condition where your immune cells damage the thyroid gland and we are not somehow able to treat the autoimmune disease itself. And the reason for that is very simple. Whenever we give an immunosuppressant to treat an autoimmune disease, you are likely to have a lot of side effects. So for example, there are a lot of autoimmune diseases for which we give immunosuppressants. For example, I can mention something like rheumatoid arthritis, where we give methotrexate, where we give hydroxychloroquine. So these are some of the agents which are used to treat autoimmune diseases. But these agents are not a good fit or not suitable for treating autoimmune thyroid disease, because we have an excellent treatment in the form of thyroid hormone. The best treatment for hypothyroidism for the last 120 years is a thyroid hormone. Okay, for hypothyroidism is treated with thyroid hormone. So please remember that the thyroid, whatever hormone deficiency is there, it can be easily replaced by giving thyroid hormone. When we have an easy treatment which does not have side effect, we do not go for treatments which may be harmful for you. So that is the reason why we always treat hypothyroidism using thyroid hormone. And thyroid hormone is a safe replacement because it is not the active hormone, it's a pro hormone. It gets converted to something called T3, which is the active hormone, and then that has effects on your body systems. So taking a T4 is very, very safe for you, even if it is a little more. So instead of taking say 100 microgram, you took 125 microgram. No harm will come to you or to your baby because you have taken a higher dose of thyroid hormone. What will happen is that TSH may go down, and a regular monitoring of thyroid function is usually done in pregnancy. And when we pick up that the TSH has gone down, we can reduce the dose of thyroid hormone. By the next visit, the TSH will become normal. So this is the importance of hypothyroidism treatment in pregnancy. What is overactive thyroid and what are the treatment given for overactive thyroid? For overactive thyroid, typically we treat using something called an antithyroid drug. The antithyroid drug are carbimazole or methimazole and propylthiouracil. In the first trimester of pregnancy, we prefer giving propylthiouracil in the pregnancy because it has been associated with slightly less chances of malformations than methimazole. And what are the risk of malformation? The risk of malformation is about 1 or 2 per 1000. So this is the extent of malformation due to particular agent actually, and it is largely safe. And even if you have hyperthyroidism, you have a lot of symptoms, we can treat with these antithyroid drug and is largely safe. And whatever small malformations do occur tend to be very insignificant. And hyperthyroidism, if it is left untreated, is also associated with higher rate of miscarriage, etc. So we better treat if you have hyperthyroidism, and if you conceive, it's better to continue treatment if you have a significant amount of hyperthyroidism. But if you have a very mild hyperthyroidism, your requirement of antithyroid drug is very less. Your endocrinologist will typically stop the drug as soon as you conceive because of the slight risk to the fetus. Once you reach 14 weeks or 18 weeks of pregnancy, so you can treat the hyperthyroidism using only methimazole because that has got better effectiveness than propylthiouracil in the long run. So these are the antithyroid drugs which are used in pregnancy, and they are absolutely safe in pregnancy when it is used for a pregnant lady who has significant amount of hyperthyroidism. Another important thing is that during pregnancy you can have very low TSH due to pregnancy itself. This is called gestational thyrotoxicosis. This is not the same as hyperthyroidism. Hyperthyroidism happens due to autoimmune disease, again an antibody which stimulates the thyroid gland. But in normal pregnancies, say 5% of normal pregnancies, you can have a very low TSH, and this does not equate to hyperthyroidism. And this will be a transient condition, say between the gestational age of 6 weeks and 18 weeks. After that, it disappears. So this is what you need to know about thyroid medication and pregnancy.